As a clinician and a surgeon, I'm impacting the lives of my patients one at a time through my care and through operations. As a researcher, I have a different type of an impact, a broader type of an impact on the field and on people. I came from Winnipeg originally, where I did my general surgery training. During my fellowship training, I was really exposed to all types of research and had the privilege of carrying out all different kinds. And so I was off to Vancouver, where I joined the faculty at UBC and the staff at St. Paul's Hospital. In Vancouver, I began the development of the research program based out of St. Paul's Hospital. And though the focus was on endocrine surgery, we studied a variety of different things. I continued to study the type 1 growth factor receptor family. We demonstrated the importance of HER3 targeting in a large cohort of breast cancer patients. And we studied in other tumor types as well, including thyroid cancer. We also continued to study uncommon and unusual cases. It's really the trainees whose enthusiasm and interest and excitement motivate me, whether it be students, undergraduates, residents, postgraduates, fellows. Really they're key in my research, and it's the mentorship that I can provide to them in bringing their work through to presentation and publication, which is a major contribution I feel I've made here and made a difference in the training of a lot of people. Not surprisingly, we also study many uncommon and unusual endocrine cases and have reported on these. And as well, as we mentioned, surgeons love application and learning new surgical techniques. When I was an ACS scholar in Japan, I was exposed to vessel sealing technology in thyroid surgery, and I brought this back to Vancouver, and now it's become really standard in how we carry out these operations. In parallel with my endocrine and oncology research, there were many general surgery questions that came up, and once again, motivated by many trainees, we studied some very practical problems that we face in the clinic on call, including issues around relating to gallbladder surgery, hernia surgery, appendix surgery, and even some research about carrying out research. Not surprisingly, a large focus of my research program has also been on the study of hyperparathyroidism, which makes up a big portion of my clinical practice, and all aspects of hyperparathyroidism, including the preoperative workup of these patients, the intraoperative management of these patients, and the postoperative management of these patients, all with an aim to optimize and improve our patient care that we deliver. We've studied all aspects of thyroid disease. In terms of surgical questions, we've looked at things specifically with respect to the optimal extent of surgery. Thyroid cancer molecular diagnostics has been a real important part of my thyroid cancer study. As you may all be aware, that the incidence of thyroid cancer has steadily been rising for greater than 20 years in the Western world, and up to 20% of needle biopsy diagnoses will lead to a diagnostic operation for what eventually is shown to be benign disease. And so improved detection of cancer is important. We've looked at this at the protein level and identified markers that we have validated and that are available to our pathologists here at St. Paul's to use adjunctively. And as well, I've also looked at it at the genomic level. I'm especially proud of this work in which we were the first to profile the entire transcriptome of thyroid tumors in order to exploit it to be able to identify some molecular diagnostic signatures. Interestingly, 2/3 of the diagnostic signatures were outside of the protein encoding genome. This has led to multiple subsequent developments. We've also continued to study anaplastic thyroid cancer. The study of anaplastic cancer has been focused on studying transformation, or this observation that I made in my patient way back when I was a trainee, that the differentiated cancer, this really good prognosis tumor, gives rise to this fairly uniformly fatal type of thyroid malignancy, and to study the changes that occur in that tumor progression. As well, we've also identified and continued to study some novel targets for treatment of these patients as well. Finally, I'd like to thank my colleagues at St. Paul's, all my trainees, collaborators. I'd like to thank Dr. Redekop and Dr. Reed, my heads. And as well, it's a real honor to be given this award, named for Dr. Finley. Dr. Finley, I'm really honored to receive this award. And last but not least, I'd like to thank my wife, Natalie, and my children, Jacob, Isabel, and Nicole, for keeping me grounded. Thank you very much.